Beginning Core Strengthening and Breathing Part 1. In order to have a strong, well-functioning core, you have to start with proper breathing. Breathing is the foundation for the entire body. Our lower core or abdominal core is very similar to a soda can. It has a pressure system. When the can is unopened, the pressure inside prevents the can from collapsing. But once the can is popped open, the pressure releases and the can is easily crushed. Our abdominal core system is similar in that there are 4 muscles or muscle groups that create the pressure system in our body to protect the spine. The diaphragm is the top of the can, the pelvic floor muscles are the bottom of the can, and the transverse abdominis and internal obliques form the sides of the can. The internal obliques lie on top of the transverse abdominis. If any one of these muscles is dysfunctional due to poor posture or weakness, the spine won't have a pressure system to support it. Diaphragmatic breathing. Lie on your back with your lower legs resting on a chair or elevated surface. Support your head with a pillow or a folded bath towel. Make sure your legs are relaxed, especially your thighs and hip flexors. Hand placement on the chest is simply to have full view of the abdomen for the viewer. Take an inhale through your nose and breathe into your abdomen, sides of your body, and your lower back. Exhale naturally through the nose. As you inhale, the diaphragm and pelvic floor move downward. The pelvic floor and diaphragm actually relax at this point. As you exhale, the diaphragm and pelvic floor move upward. As the pelvic floor moves upward, it contracts and initiates the core contraction with the abdominals. As you inhale, relax your pelvic floor and allow it to spread, feeling your sit bones widen like a jellyfish billowing. Then, as you exhale, gently contract the pelvic floor muscles in and up as they move upward like a jellyfish, contracting to propel itself forward. Don't breathe into your chest, shoulders, and neck. This will heighten your sympathetic nervous system, your fight or flight reaction, and can cause chronic stress. It also doesn't allow you to use your diaphragm, which we need to create the intra-abdominal pressure. Also, don't just belly breathe. This overexpansion in the front of the body decreases the tone of the abdominals, which then decreases the amount of tension the diaphragm has to work with. This then decreases rib mobility overall and can weaken the abdominals. Place your hands on your lower ribs with your thumbs toward your lower back. Breathe into your hands and thumbs, into your lower back, the sides of your body, and your abdomen. Your upper rib cage will move, but you're not going to breathe into your shoulders and into your neck. Use a yoga strap as a tactile cue. You can use a yoga strap or a belt as a tactile cue. Wrap the belt around your lower back and sides of your body and breathe into the belt. Diaphragmatic breathing with abdominal engagement. Take an inhale through your nose and fill your abdomen, sides of your body, and lower back with air. Then exhale slowly through your nose or your mouth to get all of the air out of your lungs using your pelvic floor muscles and abdominals. Exhale slowly, taking between 5 to 10 seconds to get all of the air out of your lungs, and gently pull your pelvic floor in and up as you gently engage your abdominals. This will flatten your abdomen. Don't use the cue to pull your belly button to your spine, as it cinches the abdominal system and doesn't allow you to bring pressure down into your abdomen, sides of your body, and lower back. Use your abdominals to pull your ribs down towards your pelvis as you exhale. don't flare your ribs as you inhale. When the ribs flare, the diaphragm cannot work with the pelvic floor, the transverse abdominis, and the internal obliques to create the natural pressure system to support the spine. Again, pull the ribs down with your abdominals as you exhale. Don't bear down on the pelvic floor as you exhale, meaning don't push outward in your lower abdomen on your exhale. Again, slowly exhale all of the air out of your lungs using the pelvic floor muscles and abdominals. This will flatten the abdomen. Don't use your glutes to tuck the pelvis under as you exhale. This can be a compensatory pattern to help increase abdominal and pelvic floor engagement. Keep the body relaxed and in a neutral position as you breathe.